I'm going to start off the Beyond Health Tips series with a focus on cardiovascular health. It is a subject very close to my heart, and you will soon understand why. Most of us know that cardiovascular disease is the greatest cause of premature death. We have all had family and friends who have died from a heart attack or a stroke, but what are the chances of it happening to you? Pretty high, unfortunately, unless you are proactive in protecting yourself. Let's have a look at some statistics. Firstly, how many people have a heart attack or a stroke? Worldwide, according to the WHO, 17.9 million people die from a cardiac event each year, and around 15 million have a stroke, of which around 5 million die and another 5 million are permanently disabled. In the USA, based on figures from the CDC, 805,000 Americans have a heart attack each year, and another 795,000 have a stroke, together over 1.5 million. Around 647,000 Americans actually die from heart attacks, and another 140,000 die from a stroke. It's unclear how many people are permanently disabled from a stroke, which can be worse than dying. Imagine how hard it must be for people disabled from a stroke who can no longer talk or communicate, but are totally aware and their minds are still okay. I don't know about you, but I'd rather be dead. One of the biggest problems with cardiovascular issues is that in more than half of the cases of fatal heart attacks, their first symptom is death. This is why it is called the silent killer. There are things going on inside our bodies that we are unaware of until the event itself occurs. It doesn't matter how fit we are or how healthy we appear to be. It can strike anywhere at any time. Look what happened to Dr. John Warner, the president of the American Heart Association. Now, if anyone should be aware of the dangers of cardiac events, it would have to be him.
At the top of his game, Dr. John Warner, president of the American Heart Association, giving the keynote speech at a major medical conference in California.
After my son was born and we were introducing him to his extended family, I realized something very disturbing. There were no old men on either side of my family. None.
Less than 24 hours after giving this speech, Dr. Warner would suffer a heart attack.
But I never would have thought that I would have had a heart attack at age 52.
Warner seemingly the picture of health. A track athlete in college, he exercises regularly, watches his diet, and does not have the traditional risk factors associated with heart disease, like smoking, high cholesterol, or high blood pressure.
I felt fine that morning, and many heart attack victims that have a sudden cardiac arrest get no warning symptoms.
As a further example of somebody whom you would not expect to have a cardiac event, look at what happened to Bob Harper.
The heart attack happened while Harper was working out earlier this month, and it was so serious it left him unconscious for 2 days.
Big pull. Pull fast.
He's the fitness guru and longtime trainer turned host on The Biggest Loser.
Bro.
But this morning, 51-year-old Bob Harper is counting himself lucky to be alive after collapsing during a recent workout session.
You're going to come off, run up and back.
The high-profile trainer sharing on Instagram Monday that he suffered a heart attack 2 weeks ago. According to TMZ, the medical emergency taking place while Harper was working out in a New York City gym. A doctor who happened to be nearby coming to his aid, performing CPR and using paddles, saving Harper's life.
Examples of people who have no risk factors and who drop dead of an unexplained heart attack are everywhere. Many people are walking time bombs but don't realize it. Here's another example. Now see this guy? This is me, just before my 70th birthday, after I'd sailed my Polynesian catamaran from New Zealand to Thailand. Here I am a year later, flat on my back in ICU after having had open heart surgery due to a heavily calcified aortic valve. I had virtually no symptoms. My blood work was perfect. But if I had not had that procedure, I would likely have been dead within a year. I'd focused very successfully on my general health, but had a massive blind spot, and that related to the buildup of calcium in my cardiovascular system, which can be without symptoms and thus silent. I wasn't alone in having a massive blind spot when it comes to calcification issues. The majority of doctors have that same blind spot, even the best ones. This is why doctors like John Warner have become victims even when everything checks out. The medical profession focuses on cholesterol as the big risk factor, but John Warner's cholesterol was fine, and I'm sure Bob Harper's was as well. I know mine was. Why is it that even when people go and have a full medical checkup and get a clean bill of health, that they still die the following week from a massive heart attack? Why is it that less than 50% of fatal heart attack victims have elevated cholesterol? Is the medical profession barking up the wrong tree when it comes to assessing the risk of a heart attack or stroke? What the hell is going on? If I'd been alerted to the possibility of calcification a few years ago and known then what I now know after a year and a half of research on the matter, I believe I could have avoided the surgery, which is very risky. Both my sister and my son-in-law died as a result of this operation, but I live to tell the tale. I'm going to tell you in subsequent issues of Beyond Health Tips the steps that you can take to give you the best possible chance of avoiding becoming a statistic. So we'll talk soon.